Hi guys, it's Madison. I'm one of the PAs here at Advanced Women's Healthcare, and I'm coming to you today to talk with you a little bit more about infertility. Infertility is a super common topic that we talk about on a daily basis here in our office, but unfortunately it is not talked about enough in the outside world. Infertility is very common. It is shown that about 1 in 8 couples will struggle getting pregnant. About 50% of those are shown to be a male factor infertility, meaning some issue with the sperm or something coming from the male side, and about 50% coming from a female issue. We at our office can test for both and can actually treat some causes of infertility here in our office. A typical infertility workup is going to start with what we call a baseline ultrasound and blood work. Your baseline ultrasound and blood work is done right here in our office and typically done on days 3 to 5 of the female cycle. I know, sounds crazy. We want you to come in on your period. Don't worry, we're used to dealing with people on their periods around here. But that truly is the best time to check on how everything is going on inside. We are able to do an ultrasound to look at the uterus, make sure that there is not any structural abnormalities or any issues that need intervention. We're also able to look at the ovaries to look for ovarian cysts or other concerns that may be impeding you getting pregnant. We also are able to do blood work. Those blood work on day 3 to 5 of your cycle is looking at your hormone function, looking to see is there any imbalance in the hormones or any cause for the infertility. It also allows us, when we are deciding on treatment and medications down the road, which medications may be the best option for you. Following that visit, we will have you come back for something called a FemView or an HSG. That is a more in-depth ultrasound that allows us to look at the inside of the uterus. On our baseline ultrasound, we see kind of a flattened version of the uterus. The uterus is kind of closed on itself. And with a FemView, we're able to put a small catheter in through the cervix and fill the uterus up with fluid. And that allows us to get a better look at the inside of the uterus, looking for any polyps or any scar tissue or an irregular shaped uterus that again may be leading to your infertility. The second part of that procedure is something called a FemView, which we can pump little bubbles in through that uterus, and those bubbles make their way outside the fallopian tubes. This allows us to check to make sure the fallopian tubes are open and that there is no blockage that is going on. It's very common for fallopian tubes to get blocked. They can be blocked for a myriad of different reasons, but think of it like a traffic jam on a highway. If that blockage is in the tube, the fertilized egg is never going to make its way into the uterus, and you are going to have a higher risk of something called an ectopic pregnancy or a tubal pregnancy, which is not a successful pregnancy. So that procedure gives us a lot of information. It's not going to be your most fun visit to the office, and we do recommend taking some Motrin before coming in because you are going to have some moderate cramping with that procedure. But typically following, you're able to return to your normal activity, work, or whatever you had planned for the evening. That information is used along with the hormones to come up with a plan of care. In addition to the female workup, we always recommend a sperm analysis in the partner. Like we talked about earlier, about 50% of infertility is related to a male factor. So we don't want to go through all of this workup and all of this treatment in treating a female if we're dealing with bad sperm or male factor infertility. So it's always going to be recommended that we get a semen analysis in the male partner, and this is something we can order for your partner. Once we collect all of this information, which takes about a month, we can come up with a plan of care for you. Whether that be medicated cycles, where we use medication to help you with ovulation, to help you with follicle development, or whether we refer you for something called an IUI, which is an intrauterine insemination, which is a process of us taking a sperm sample and putting it into the uterus to get those sperm closer to the egg for a more successful fertilization. versus do we feel like you would benefit more from going straight to a reproductive endocrinologist for an IVF or an in vitro fertilization pregnancy? That is not something we do here in our office, but we work very closely with our area REIs or reproductive endocrinologists and can refer you out if needed. Additionally, depending on that workup, we may recommend a procedure, a surgery, something like that to increase your odds. So starting out the infertility process, I know can be scary, but it is something that we do recommend if you've been struggling on your own to get pregnant. Again, this is something that is personalized to you, and so we can always answer any additional questions and go through a more perfect plan that is geared towards your issues and your problems at any visit. Just let us know if we can be of help. Thanks, and have a good day.